Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Central Florida. Tonight's topic is parasites, P and purpose. So let me know where you guys are from. Let me know if you can hear me okay. One of the most common things that seem to irritate patients that we work on are undiagnosed, hard to diagnose, hard to identify, hard to find in blood work, hard to find in a colonoscopy, hard to find in a fecal sample. Challenges that can come from these little creatures. Hey, Alyssa, can come from these little creatures called parasites. And so in the United States, for whatever reason, American physicians and medical staff are very much I almost said the dark side. Very much in the dark about parasites. Maybe a pediatrician's, trained in pinworms and they do the tape test where they take the popsicle stick and they wrap the scotch tape on the outside and they stick the popsicle stick around the anus and they're looking for parasite eggs. Perhaps a general physician, if a patient went traveling and came back with vomiting and diarrhea, may look at parasites. I think most of them are familiar with malaria, which is a mosquito-carried parasite. But when it comes to other types of parasites, so there's amoebas and protozoa and strongyloides and nematodes and tapeworms, and there's many, many, many types. Parasites that live in the liver, parasites that like the lung, parasites that live in the brain, parasites that go in the eye, parasites that go in the urinary tract. There are parasites that go in every single organ, and unfortunately, they can be very challenging to find when they are not in the typical place that a general physician may think of them. I think typically when you hear parasites, you think of them in the digestive tract. They have their little suckers and they suck nutrients out. At one point, people were given tapeworms to lose weight, right? I do not advocate that treatment. That's a horrible idea. But you can lose weight with the tapeworm. You can also gain weight with the tapeworm and get super, super bloated and have irritable bowel type symptoms where you have diarrhea, you have constipation, you have bloating, you have nausea, you have dark circles under the eyes, grinding of the teeth, nightmares. There's parasites that can crawl out of the anus and go into the female vagina and cause infertility, cause endometriosis. Can go into the urinary tract, so that's why we have P listed. It can get into the urinary tract and also cause you urgency. So, like the patient has to go to the bathroom like right now. There's like no waiting, or they pee their pants. So a lot of women, they have, it's called urinary urgency, like they got to go now, or male patients, they got to go now. But with females, they tell the female that it's due to childbirth. Like, oh, well, you squeeze the baby out your vagina, not your pee hole, guys, the vagina hole. And just to clarify, there's two different holes there. And that's why you have urinary incontinence, because you damage the pelvic floor, the muscles around that area. But it can be an immune challenge. It could be parasitic. How did the parasite get in there? So you go swimming in a lake, you go swimming in an ocean, you go swimming in a swimming pool. Chlorine doesn't kill parasites, guys. Some of you guys are like, I'm never swimming again. You can go swimming and they can swim into any orifice. An orifice is a hole. It can get into the ears. It can get into the sinuses. So some people have chronic sinusitis or sinuitis or sinus issues because they have parasites in their sinuses. Floaters in the eyes. There's something in there. You're looking at something. Could be a parasite. And so these poor women pee themselves. They don't want to do certain things, and they just think that's what life's going to be like. So they might wear a pad or they might wear a diaper. They always looking around for the nearest bathroom. A lot of times these women will be dehydrated because they'd rather be dehydrated than have an accident. It's embarrassing. I had an interesting case. I had a patient who was in a car accident, and she saw another doc before me, and she really wasn't getting the results that she was looking for. And by the way, you can fire your doctor, right? So if you don't think I'm doing a good job, you can fire me. If you don't like your general physician, you can fire them. And so she didn't feel like the injuries from this car accident were getting any better. And so someone told her about go see Dr. Palmer. So she ends up in my office, and I'm doing a chiropractic exam on her. So I'm doing an exam on her neck and her mid back and her low back, and then her two hip bones called the pelvis, and the bone in between those, which is called the sacrum. And I noticed that when we did a specific orthopedic test to see, and chiropractic test to see how the sacrum was functioning, some people call it the tailbone actually comes off of the sacrum. Her sacrum was jammed. It wasn't working right. So, maybe with the impact of the car accident, that bone got jammed and it was having issues. And so she said, she goes, yeah, I have spine pain from this accident. But one of the things that happened was that I can't hold urine. And I said, well, what do you mean? And so for us, we consider that a red flag. We consider that a, oh no. We consider that, it could be a very, very indicating a very bad problem with nerves. So my ears kind of perked up and I'm like, what do you mean? And she goes, well, I go to work and I'll eat like toast. I'll eat dry stuff. I won't drink any water when I wake up. I won't drink anything with my lunch. I won't even have like fruit like watermelon, anything with liquid soup, anything liquid I won't touch until I get home. Because if I have a glass of water, I can't hold my urine. It falls right out of me and I pee my pants and it's very embarrassing. And I was like, oh my gosh, like this lady might need surgery. So I said, well, let me do an exam and let me see what's happening because that's awful. And I found that her sacrum, so it's supposed to be balanced. I felt like her sacrum was jammed to the left. And I'm like, okay, well, I'm seeing that you have injuries from this car accident. And one of the things I'm finding is your sacrum's like totally jammed. I looked at her x-rays. There was nothing broken because when two things speed and metal crashes together, you can break bone, you can break your arm, you can break your wrist. Like, so if you are in a car accident, you come see us, we will send you for spinal x-rays to make sure you're okay. Because I've seen so many people go to the hospital and they're told that they're okay and they're not okay. The craziest one is a lady had a broken collarbone and she's like, Dr. Palmer, I went to the hospital. They told me I'm okay and nothing was broken, but it really hurts. And I said, why don't you bring in those shoulder x-rays and let me take a look? And I was like rubbing my eyes and I was looking again. I was rubbing my eyes and I was looking again. And this is like the olden days where you have like the x-ray film. So back in the day, just like photography had like photography film that had to be exposed, we had big old x-ray film. It makes me sound really old. Anybody else on here know what I'm talking about? It sounds like old, right? And so I'm looking at her x-rays and I'm like rubbing my eyes and I'm like, her collarbone was like this. And so I had a chiropractic student intern. I loved to mentor them. I loved to have them shadow. And so they were in the office with me and I said, Doc, what do you what do you see? I can't call them doc because they're not doctors yet, but I was like, hey, what do you see? And they're like, yeah, collarbone fracture. And I'm like, yeah. I go, here, read this report. And the radiologist at the hospital said no fracture. I'm like, well, patient, I think I know why your shoulder's hurting so much. And she's like, well, why is that? And I said, because you got a big old crack through it. And I showed her and she's like, oh my gosh. And the poor lady, she couldn't put her shirt on. She couldn't drive. She couldn't cook. She had trouble in the shower because her collarbone was broken. They missed it and they just gave her pain pills, which are super, super addictive. So going back to parasites, yeah, they could be anywhere. They can go any place. Where have I seen them? You name a spot, I have seen them there. They tend to like injured areas. So, if that lady didn't heal properly, it could have been in the joints as well. And so these are really, really, really big problem. Guys, you're not out of the parasite scope. You can also have urinary issues with parasites. I've had patients with parasites in their penis. How did I know? Because one actually told me this last week. They urinated and they noticed that something came out that was red when they urinated. And upon further inspection, found that it looked like a bug, looked at it further. So this guy's background is research. So analyzed it further and described it to me as a red moth with wings. And I'm like, a red moth with wings came out of your urinary hole, let's say it like that, also known as a urethra, when you were urinating. So that's all the fancy way of saying that. When you were peeing, and oh my goodness, and I go, excuse me, like most parasites I see that look like strong, look like pieces of spaghetti, or they look like slimy things, or sometimes they have antennas, or sometimes they're kind of fat on the midsection, like they're wider on the midsection. He's like, yeah, I had wings. I'm like, wings like a butterfly? Wings like a what? He's like, wings like a moth. And I'm like, oh my gosh, they have wings. And what was interesting is when he passed this parasite, because ideally you poop them out, right? So we test to see if this is something we need to help body balance your body out. We figure out the exact right homeopathic or herbal tinctures, which mean liquid. So this would be an herbal tincture. This is Isbor. And so like Isbor has sweet wormwood in it, right? It's meant to get rid of parasites. Milk thistle, which helps with liver. It has, let's see, turmeric, which helps with inflammation, cat's claw, which is a super powerful herb, pau de arco, which is a bark that helps kill buggies off as well. It boosts the immune system. So really, really powerful stuff. Actually, you guys want to do a shot with me. The parasites have been really bad. They were really bad so far this week. And so, anyways, he passed it. He peed out this parasite. And so, men, you can get parasites in your prostate when you have something that is inflamed. So prostatitis. When you So Alyssa McCool is making me laugh. She said, I wish you could hear Chad's commentary right now. But Chad can type in the chat, and I'd love to hear his commentary. Robin says, parasites got me this week. Oh, no, Robin. Mia says, I agree. Alyssa says, what the heck, tapeworms on purpose? Yeah, tapeworms on purpose. Not okay, guys. Like, it is my belief as a natural physician, I'm a doctor of chiropractic, it is my belief that it is not okay to try to rebalance the body. It is not okay to help the body heal itself, because as a doc, I'm not healing the body. The body's healing itself. I'm just kind of helping to rebalance it, right? So I don't think it's okay to injure the body to help the body. I think that's really, really bad. I had a patient, she was having severe vaginal pain. I guess it's vagina penis day on this live. So we'll see how long this lasts on Facebook. But she had severe vaginal pain, which is awful. And she went to her OBGYN, and the OBGYN's like, I don't know. So it's not really good when your doctor says, I don't know. If I ever tell you I don't know, it means I don't know, but I will look it up and we'll figure it out. That's my answer. So the doc says, I don't know. And she told her, well, it could be a fungus. So what we'll do is we'll put a fungus in your vagina and we'll see what happens. I'm like, excuse me? No. Like, what do you mean? Right? Like, I don't like that idea. Or exploratory surgery. What does that mean? That means we don't know what's wrong with you. So we're going to make holes in you, and we're going to explore. We're going to see if we can figure out what's wrong. If we find out what's wrong, we'll just cut it out. All right, that's exploratory surgery. So instead, in quantum nutrition testing, my purpose as a quantum nutrition practitioner, as a quantum nutrition instructor, as a quantum nutrition founder, is to help practitioners locate the cause of a patient's symptoms, the cause of dysfunction or dysregulation, or the body not working properly. Those are all words that are similar in meaning. Find the cause. What is it? Is it a bug that's stealing their nutrients, right? Is it a mold toxicity? So mold, living in mold, or being exposed to wet basement or leaky pipe or whatever, mold can increase estrogen. So in women, increase estrogen can lead to cancers like breast cancer or cervical cancer, ovarian cancer. Increased estrogen in men can lead to gynomastia, which means you grow boobs, you grow female tendencies, female characteristics, and you lose or you decrease male characteristics, including less testosterone. Normal sperm morphology means shape, the study of shape, and motility. So back in the day, the percentage was higher to consider a man fertile. Now it is 4%. If you have 4%, you're considered healthy. 4%, like those are horrible numbers. And the problem is there's so many things in our society that are toxic to men. There's so many things in our society that is toxic to women. and it causes issues. So going back to the prostate, there's parasites that like to get into the prostate. They inflame the prostate. Sexual function is not going to work right, and then urination's not going to work right. So those are the guys that they pee and then it stops, the flow stops, they start stop, or the flow is decreased. And so there is a cause to why the prostate got inflamed. It didn't just decide one day, oh, I'm going to be inflamed and make this guy miserable. From a female standpoint, there's a reason why urinary incontinence happens. It just doesn't happen, right? There's a cause to that. So, with quantum nutrition testing, it is my purpose to help patients find the cause. Once we can identify the cause, we can fix the problem. If you got a roof leak, you got to find the cause of the roof leak. Do you have a loose shingle? Do you have a hole in the roof from a hailstorm? Do you have, right? You're not going to wait till the rain is pouring down into your bedroom. You're going to figure out what it is. So maybe you need to fix the shingle, or maybe you need a new roof. When we're working with the human body, we're not going to give you new parts. I'm not going to give you new parts. That's not what we do. Is your parts can regenerate themselves. Every 120 days, you have new red blood cells. Every 7 years, your lungs have completely regenerated themselves. Your body has osteoblasts that build up bone constantly. Your bones just aren't your bones from when you're a kid. This bone has changed throughout my whole entire lifetime. Osteoblasts have built it back up, and osteoclasts have torn it back down. What you're consuming on a daily basis builds your body. So if you're eating McDonald's and other fast food and junk, you are rebuilding your body with junk, and then you're going to have health problems. If you have health problems, then we look for the cause of what the heck happened. Is it mold? Is it a chemical toxicity in the air we breathe, the water we drink, the food we eat? Is it a heavy metal toxicity? Is it a medication with a side effect? Is it something that you're eating? Is it radiation? Is it stress? We look for why. We look for why. You're a mechanic. If you have car problems, you want your mechanic to look for the why. You don't want the mechanic to be like, well, let's take the transmission and put a new one in. That's an expensive exploratory mechanic, right? If you have problems with your brakes and your car's not stopping properly, you don't want your mechanic to explore the car and take the headlight out, right? You want them to handle the problem, find the cause. So with the human body, sometimes I feel like a body mechanic. We're evaluating the body for its normal function, and normal does not mean common, because if you have your normal headache, that is not normal. You have a common headache, meaning you have it so frequent that you think that it's normal, or you have a migraine so much that you think that it's normal. Normal means normal function, and normal function should be healthy function. If you have symptoms, I can tell you right now you're not healthy. People come in, they're like, oh, Dr. Palmer, I'm healthy. I have Chick-fil-A every now and then, and I have migraines, and I had my ovary removed, and I have chronic sinus issues, and I get bloated, and I have diarrhea, and I have constipation, but they're healthy. I'm like, I don't know what your definition of healthy is, but it's not mine. Mine is 100% of your parts working 100% optimally. If you're missing parts, like you're missing an ovary, you're not 100% healthy. If you have symptoms, you're not 100% healthy. And so we look for the cause, what caused it. We balance out the body with whole food supplementation, herbs, carbon technology, homeopathy. We hold your hand and pull you, push you, encourage you through the way, because sometimes we need to make lifestyle changes. A really common theme in a lot of the patients I've been working on is very, very high stress levels. When you have high stress levels, you also have high cortisol levels, which is a stress hormone. When you have high cortisol levels, you can't make proper hormones. You can't make testosterone. You can't make progesterone and estrogen. Cortisol will block those hormones from being made. So you will have imbalances. One of the hardest things that I have to handle, or I have to help patients with, is handling their stress, right? The last 3 years have been freaking crazy, especially if you watch my husband's show, Dr. Jason Dean on Brave TV, right? They've been crazy. If you have any idea what's been occurring, it's been high stress. And so that high stress in the environment causes cortisol to go high. Then you'll experience weight gain around your waist, right? You get the love handles. During the pandemic, when My patient visits in the office went from 600 visits to 100 visits. It was very stressful. When my dad hit his head and had a stroke, it was very stressful. When they put him on the COVID floor when he didn't have COVID, that was very stressful. So many of these events can occur, and when your cortisol levels go high, you'll gain weight, you'll be puffy, your hair will fall out. Females, you'll have PMS symptoms, right? PMS is premenstrual syndrome. You shouldn't have PMS. You'll have bloating, you'll have breast tenderness, you'll have heavy periods, like heavy periods, or clotty periods, or skip periods. Guys, you're not out of the loop either. You'll lose hair too. You might go bald, right? You'll gain weight around your stomach. You can work out and still look squishy, right? Your testosterone levels will go down because you can't make testosterone with high cortisol. And if you're trying to have babies, it won't happen, right? You won't have fertility. And this is becoming a major problem in the United States. When I was a kid, I remember, I don't remember seeing fertility clinics. I don't remember, even when I was early in practice, my practice started in Central Florida in 2015. No, that's wrong. 2005. Oh, where did I go? 2005. I didn't really have a lot of fertility cases coming in. Now we get fertility cases every single week, or we have cases where mom wants to have a baby so badly that they do very expensive fertility treatments that involve chemicals and implanting embryos. And I'm not making you guys wrong if you've done that. I'm not doing that. I'm just saying if the body's working properly, then those things shouldn't have to happen. All right, let's see. So Dicko says, all the way from Australia, I went to the chemist as I thought I had a parasite in my eye. And she was talking to me through her mask and looking very gray. Oh, probably because she has no oxygen. She told me that humans do not have parasites. Bullshit, Dicko. I just looked at her with my jaw on the ground. She was an actual chemist, not an assistant. Okay, so maybe she was an ophthalmologist or optometrist. But yeah, they're amoebas that get in the eye. They're no joke. And so you can go to PubMed and look up eye parasites, and you can go back and give her some PubMed medical research. Not that I think PubMed's great, but yeah, the medical community does acknowledge parasites, does find parasites, but they tend to ignore them. All right, Mia says, Dr. Palmer, can you explain how quantum testing works in a simple way to understand? Yeah. So quantum testing is what we do at Palmer Natural Health. It is a way of evaluating the body using frequencies, so using energy. So sound is a wave, light is a wave, color is a wave, right? So those are wave frequencies. So it's a way of evaluating the body to see which organs and glands through frequencies are working optimally and which ones are not. And then we match the frequency. So say this is the heart, and the heart is not optimum because it's racing, it has high blood pressure, you have chest pain, you have irregular heartbeats. This is not at optimum. We match it with the frequency that it needs to heal. So this wave is one formation, this wave is the opposite formation. When we put them together, it cancels out and improves the organ or the gland. We're not giving protocols, we're not guessing at things, we're testing to see what is the exact right herb, whole food, homeopathy, carbon technology that the person needs. During the pandemic, I had a patient that was super scared, and he was local, but he wasn't willing to come in. I said, okay, well, based on everything that you're telling me, I think it's XYZ, and I'm going to recommend these 5 supplements. And so I said, but you know what? I would rather you come in and I muscle test you and I evaluate to see what exactly your body needs, right? So just like an EKG can give you reading on the heart, when we're muscle testing, we're asking the body through a reflex, what does the body need? If it needs something, or that it matches with the frequency, it has a response. The response can be the arm is up, or the response can be the arm is down. Just like on an EKG, the wave pattern indicates stuff. So if a wave looks a certain way, you have healthy heart function. Even though they didn't put the electrodes, they didn't put the little pad thingies on your heart, they put it on the outside of your body. So you're telling me these electrodes send signals, they send electrical signals into your heart. It reads the heart electricity, sends it back through the electrodes, sends it into the computer, prints on a graph or prints on a computer screen and says, this is your heart function. Quantum nutrition testing works in a similar manner. And so we're able to evaluate what areas are imbalanced, what areas are good. We are able to determine which areas to work on next, and then looking by matching frequencies, what is the cause? Is it mold? Is it chemicals? Is it metals? Is it this? And so we're able to do that both in person and from a distance using quantum entanglement theory. It's a quantum physics theory. So with that patient I told you about, I said, you need to come in because I haven't tested you from a distance. I didn't know how to do that then. I learned it when my dad was in the hospital out of need, out of desperation, out of wanting to help him. And so the patient came in. I remember he's wearing ski gloves and a ski goggle on his face. And I'm thinking, this poor guy is terrified. And so I tested him. He didn't really want me to touch him, but he let me because we did not wear masks since they don't work for stuff like this. They're not meant for stuff like this. And out of the 5 supplements that I used my big doctor brain and guessed without quantum, guess how many I got right? I only got 1 right. And I'm like, this is not okay. I'm not happy with guessing. I'm not happy with throwing something against the wall to see what sticks. It's an Italian saying, right? Throw spaghetti against the wall, see what sticks. I'm not happy with that. And so then when I figured out how to test quantumly, we learned that we can, just like you can call someone on your cell phone, this is not connect to any wiring, right? Just like a cell phone uses frequencies. So my phone will send frequencies to you, Mia, on the other side of Orlando. It calls your phone, we answer, I can say whatever, you can hear me. What's even crazier is this phone not only will send audio or sound, it will also send pictures. How do the pictures get from my phone to your phone? Do they like fly in the air like Wonka Vision, like Willy Wonka's Wonka Vision? And then what's even, I believe, even crazier is I can find a cool video on, I don't know, a cute baby laughing and can send it to Mia in Orlando, but I can also send it to Dicko in Australia. And somehow, magically, this flies in the air. Do you guys know how your cell phone works? It flies in the air. It reaches Australia with the video, with the sound, with the color, with the movement in sequence. How the heck does that work? And most people, when you ask them, they're like, I don't know. The short answer is it works on frequencies. So really, really cool. So we use that quantum technology to test patients to figure out what's balanced, what's imbalanced, and then putting together a personalized program for them. All right, good question. Jenny is saying, I'm studying high cortisol right now. Can cause high blood pressure. Absolutely. Calm the body with meditation, yoga, lemon balm, breathing techniques. Yeah. So we teach patients what will help to decrease stress, right? Sometimes it's how they look at things. Do they need to go for a walk? Are they over exercising? So some people that are doing CrossFit or they're doing like high intensity workouts actually are driving the cortisol higher. And so I know that I like to have hard workouts. And so my friend Ethan goes to a high intensity workout place. And I've been wanting to go. And every time I drive by the place here in Orlando, I'm like, I want to go there. But I have a tendency to overwork out. I was a professional athlete. And I believe that my viewpoint is if you have a hard workout, it's a good workout. And if you have a gentle workout, then you just took it too easy. And so I've actually kept myself from doing high intensity workouts because I already know my stress levels can be high. And my cortisol at one point, especially during the pandemic, was very, very high. And I didn't want to push it higher. So that's why I haven't been, I'm doing things to decrease stress, like walk my dog and do some yoga and stretching and journaling and keeping up with my planner and having awesome teammates and stuff like that. And of course, getting quantum tested in chiropractic. All right. Robin says, Jonathan, don't forget the full moon comes in 8 days. Yeah. So thank you, Jonathan. Around full moons and new moons. So last Tuesday was the new moon. Some people will react during new moons when they have parasites. What does that look like? It looks like aggression, irritability, over emotional, bloating, constipation, diarrhea, nausea, right? So the moons can stir up parasites. Why? Because parasites have a high water content. And just like the moon can affect tides in the ocean, it can affect parasitic behavior. And so what we'll find is before new moons and before what Jonathan's reminded me of, full moons, parasites will be more active. When they're more active, guess how you feel? You don't feel good. You can feel You can't sleep, you're bloated, diarrhea, nausea, vomiting, grinding of the teeth. Um, Depending on where the parasite is, you can have more symptoms. Right, Paula says quantum nutrition is awesome, so patient specific. I totally agree. My purpose is to help people heal, help people balance their bodies, help people improve their health with quantum nutrition testing, finding the cause, and helping balance out the system with whole food nutrition, homeopathy, herbs, carbon technology. I am extremely concerned that our future generations will not have healthy spouses, will not be able to have families of their own, and will not live with the same lifespan as their folks. And so, if you need help, if you have symptoms like urinary symptoms or any of those symptoms I mentioned, if you are on medications, if you have had organs and glands removed from your body, please feel free to reach out to us. This Saturday, April 1st, and no, it's not April Fool's joke. We are having a very amazing special. You can become a client or patient of Palmer Natural Health, where we can look to see what we can do to improve your health naturally with quantum nutrition testing. Normally, that visit is about a half-hour consult where we're working with you and we're asking you questions on your health, on your family history, on your surgical history, on your dental history, on any environmental exposures. If you're a female, on your pregnancies, how healthy are your kids, and so on. We're taking that data, we're doing quantum nutrition testing on that data. We're coming up with a personalized nutritional program that's going to rebalance your body so your health improves. We're delivering that report, which is about another half hour. So it's about an hour of appointments and over an hour of work on our part. And typically it's $250 in our office, right? So a lot of consult, a lot of patients tell us it is the most communication, it is the most time that a healthcare professional has ever spent with them. And the most specific information that is given in the report, and then a personalized program where people are, they're getting improvements in a day and 3 days and a week. They're having noticeably improvements. And of course, you have to qualify, right? So, like, there's some cases where person's on death's door is probably not going to be a case that we accept, not because we don't want to help them, but just because they waited too long. So please don't wait till then, because I'll tell you it's too late. I don't want to say that. Or they're just not willing to do what it takes, right? So I can't help someone who wants to eat Dunkin' Donuts. They want to eat donuts for every meal. I can't help someone who only eats McDonald's, right? I can't help someone who isn't willing to make the changes to improve their health. And all the things that we're going to ask you to do are things that I would do myself. I would never ask a patient to do something that I wouldn't personally do. Okay, so let's see. So Gina says, I met Jonathan at Facebook Live lunch with you. Yeah, you did. Let's see. Cool. Excellent. All right. Well, if you need our help, a consult is very much discounted to help people. This Saturday, April 1st, if you're a distance patient, you can call in starting tomorrow. Actually, I'll let the staff start taking those calls and say that you want the very special April 1st, not April Fool's joke, $99, $99 to have a consult, a report, and a program, personalized program created. It's amazing. So if you have a friend, a family member, a spouse, a kid, a neighbor, definitely is the time. If you've been wondering if you want to work with us, now is the time. You have to ask for the April 1st special, and they will honor that because I said so. And then if you're local, come by. We're having a garden party. We're going to have a bounce house. We are going to have essential oils. We are going to have a petting zoo with a baby goat or baby lamb, not sure, baby chicks, bunnies that you can pet. We will have food. We will have chair massages. We will have complimentary quantum scans. We will have information if you want to learn more about quantum nutrition testing and become a practitioner. We'll have information on that. We'll have cool handmade jewelry to buy, different types of flowering in baskets, some different things that you can do to improve your health. It will be awesome. So you are very welcome, Melissa. I'm glad. It's the best thing you've ever done for your health was the quantum nutrition testing. I agree. And she's studying in our Quantum Nutrition Academy. Teresa says, always look forward to your Tuesday lives. Thank you. You're welcome, Teresa. If we can help in any way, please reach out. I'm Dr. Lisa Palmer, Dr. Mama Bear. Bye, everyone.